Yeah, and I've seen you have injectables, there's cream. Is there pill format too? Yes.
So there is pills, and that's kind of like, being looked at. It was one of our first lines, but guess what? Whenever you go into your stomach,
Yeah.
has to go through what's called the first pass metabolism. And so your liver takes most of it out.
Okay.
So we had to give really high doses to get it through the liver. So it would cause hepatotoxicity. Some people, had big acne and a whole bunch of other stuff. So the orals were never,
Never like
most popular. And then
what
they
is the
came up
cream one?
the test. And I think what's cool about the creams is it's, yeah, like it's provincially covered for our patients. So it's not going to be a whopping price. It follows the natural curve. So if you're doing it once in the morning after a
Oh, it's
shower,
just a cream you put it.
it's a gel.
It's a gel, yeah.
And within a really rapid amount of time, it's absorbed. So it's the vector is this sort of alcohol that, it was once Axtron under the armpit, like a deodorant.
Yeah.
Now there's androgel, there's Testim, like a foam. There's even one transnasal. So
Wow.
the whole concept transference where you put it on and then you're gonna go hug your son and your daughter while hey mom, I'm growing a mustache. So
Uh,
so
uh,
so
I'd use my son. Come here, boy. Give you a hug.
big hug. That's always hugging me. So the whole idea that there's that other option where is there an option that's going to be no transference, to the other partners of the family, and it's in the nose, and that's the testo. So it's the sort of the new kid on the block,
Wow.
and they're
So
great.
you're taking like your
Yeah,
TRT
just
and
it's this like
to a
almost like
spray, yeah.
a type of oil, and kind of like hydrates your nose, and you put on one on each side, and you do it twice a day, and it follows that natural up and down pattern. And it's one of the few TRTs, testosterone replacement therapies, that has some evidence that it protects spermatogenesis. So some men here, look, I want to have children, but if I'm going to do those other forms, I may get some testicular atrophy and may impact the spermatogenesis or making of sperm for fertility. So, there is those options. There's in the States other ones who do implants or, but they're not as popular or as available in Canada.
And then you have the injection, which is probably the most common one.
I,
Is it?
again, everyone has different views, and I know other family members and so forth who are doing the injectables, but they just don't want to have, do it every morning, and they'll do the injections, but there'll be more cyclical changes day to day, week to week, because they'll do a big bolus, and rather than having a smooth pattern, you'll go super physiological and then decline. So if you look at the data, in terms of what are the biggest side effects, some people just, I don't want a needle. I have to inject
Yeah,
myself.
I
It'd
wouldn't
be
be
a
able to
pain
do
at
that.
home.
I wouldn't be able
Kind of like
to.
it's suspicious and so forth. But everyone has a different view, and some people it works great. Some men who are big hairy guys and sweat a lot, that may be the right option, because it doesn't get into the skin. So everyone has different views. Some people enjoy the boost and being that super physiological, but there may be a chance that you'll have some of the side effects of TRT, which is increased hematocrit, so thicker blood, kind of like some of those cyclists, they dope and you get thick blood, you can get clots. So that's why we check hematocrit to check the thickness of the blood. We'll check the liver function enzyme. So some of these could be toxic at high levels. Um, and then you have to check the PSA for men in certain ages for prostate cancer. It doesn't create prostate cancer, but if you have prostate cancer, you may be feeding the fire. And those other elements of checkup is important. So by doing those different options, at least knowing what they are and making sure that you want to deliver them and that you're going to be consistent,
Mm.
that it's going to be easy in your regular lifestyle. And are you hugging your family all the time? You have young kids, or are you looking to have children? Those are going to be some of the questions you're going to want to personalize in your treatment.
Good. So I wanted to ask you another question, which is a common question that we've talked about in the show in the past. What is the difference between Viagra and Cialis?
Yeah, I mean, they're both a pill. They're both in that same class. They're PD-5 inhibitors,
Okay.
phosphodiesterase and 5 inhibitor, which is the enzyme that helps detumesce the penis. So if you
Okay.
inhibit the inhibitor, the tug of war, when you get stimulated, it'll gain the erection and maintain the erection longer.
So how do they work differently?
Half-life. The molecule, they're in that same cluster of a molecule to work within the vasculatures, within the vessels, of the certain arteries of the penis. If you look at
No.
Viagra,
Yes.
it was never meant for that.
It's meant for the heart, right?
No, well, it was meant for patients with pulmonary hypertension.
Okay.
So if you're going skiing up in the Alps, you take a Viagra, you'll breathe easier. So patients were men and women taking these Viagra 3 times a day as a study to see
No way.
how does it affect pulmonary hypertension. So as a side gig, they
They were-
realized that
They
it
all
helped,
started getting erections.
and then they realized that the receptors are also down below, hence the billion-dollar business. So Viagra is the first. Its half-life's around 4 hours, so it's quick onset. It is
Quick onset meaning you take a Viagra.
about half an hour later, it's in your system.
So if you're gonna have intercourse, you take it half an hour before or an hour.
And up to 12 hours because of the half-life.
Okay.
It's best taken on an empty stomach. So if you were going to go have a very fancy meal, it may be less absorbed
If you eat.
if you have a lot of fatty meals. So it's
Oh, I don't know.
so, and then with Viagra, the unique to it is it may, so you also have phosphodiesterase inhibitor receptors in the back of the eye. So some patients who take Viagra, when they look at the light, when you have the choice at your retinal depot, you have white light and blue light and, that kind of blue hue. So some people who take Viagra will see sort of a bluish hue. Like they'll see clearly, you won't crash the car, but
Yeah.
your interpretation of the white may be off a bit.
And how long does it stay in your? So you'll take it 30 minutes before, and it'll stay in your system for how long?
Up to, like say, like it's the 1 day pill. So if you take it today, it's good for 12 to 16 hours.
So the Viagra will stay that long in your system.
Right. Doesn't mean you walk around.
Yeah. You
getting-
still have to be stimulated, excited. It's not an automatic.
Correct.
Yeah,
It
no
helps a
erection.
natural erection
Okay.
versus the injection we talked about before.
Yeah.
You could inject in,
Right away.
that's not right away,
Not right
within
away.
10 minutes, but it initiates something that is independent of stimulation.
And the Cialis, what's the difference with Cialis then?
So the Cialis, everything has 2 names. So,
Yeah.
sildenafil and as by
Danafil.
tadalafil, and there's a Levitra, which is kind of like, there's a third kid on the block.
Oh.
But no one really talks about it.
It's a new?
No, it's
Okay, it's okay.
that's not new.
It's the only two I've heard of.
It's the
so-
2 of, and I think if you look at some of the data for Levitra, it had most of its data on diabetics and so forth. But it's one of those third options where some people will come to see me and they're like, look, the Viagra, I got a headache, and the Cialis, I got muscle aches, and there's, let's try this. I always try as patients here, like, try 2. I don't know which one's going to be best for you, but depends on how often you have sex.
Yeah.
And so the cool thing about the Cialis, it comes in, let's say, 2 different ways of delivery.
Okay.
One is what's called PRN, before, like, hey, honey, tonight's the night. The half-life is longer, so it's up to
So
36 hours.
So you'll take a pill how long before?
Same idea, about half an hour.
Half an hour.
So
And it's going to last for?
up to 36 hours, kind of like the weekend pill. So it was developed later, so it came out a few years after Viagra, and with it was, go have a fatty meal, go have some wine. It won't be impacted by absorption. And
But I'm assuming in that case, the Viagra is probably more powerful in the short term. Would you or no?
well, again, some people assume, well, it's Viagra max dose is 100 milligrams and Cialis is 20 milligrams, so it must be more potent.
Yeah.
It not the same correlate.
Okay.
But or if I take Cialis, what if I take double dose? Will it be
Yeah.
better? You'll be wasting your money, and you may have more headache or stuffy nose or back muscle aches. But
So I know in a prior show we talked about taking Cialis daily, that it was
so that was the other benefit of Cialis. So if you look at Cialis, because I joke around as like kind of the wonder drug, because it's FDA approved for daily use. So you take a small dose every day. I call it the C5 daily Cialis, a 5 milligram pill. You just take it every time at the same time, and by the
It's like
fifth-
taking a vitamin.
it's some say the C5 vitamin. It's your like Forever 21 pill. And here's what we know and what they're approved for. Number one, it helps be like your Cialis 20 after your 5th dose. So you're taking it regularly. So you don't have to sort of time like,
Yeah.
let's honey, give me a second. Let's, triangulate.
I need a pause. I need a break.
Exactly. It just in the
I'll be
system.
back in 20 minutes.
Less side effects because you're not getting that big pump boost of a 20.
Okay.
And then, that's for erectile function. And then it also has been shown for men who have enlarged prostate, who are taking Flomax, who take these pills to relax their prostate, to urinate better. It does the same job,
Oh,
but it doesn't have any impact on ejaculation, which these other alpha blockers that we give to men with enlarged prostate relax their prostate, but, impact when they ejaculate, there's less fluid that comes out. So if you're on Rapid you're on Zatril or Flomax, these pills relax your prostate and impact ejaculation. They don't do anything to erection. The Cialis 5 daily does the exact urinary parameter improvements for BPH, a benign prostate hyperplasia, and make erections better. So what's the side effect? Like, sounds so great.
Yeah.
I joke around, it's like poverty because it's like $80, $90 a month. So certain people who have insurances who've tried the Viagra, who've tried Flomax, who get headaches or so forth, then could say, look, I've tried a few of the alpha blockers. I want to do the Cialis.
So you think I mean, I guess a man over 40, 50 who might have mild erectile dysfunction, or he could take it on a daily basis.
So yes, I mean, if you have the financial aspect to do it, and there is some data. If you look on men who are taking PD5 inhibitors, they looked at a retrospective study out of California published 2 years ago. Men who are on these PD5 inhibitors, again, it's not a randomized study. We need that kind of data to make the statement. But wow, after 16,000 patients who were evaluated, men who were taking those pills, is because of the pills, or maybe they were watching their weight and exercising, but they had less coronary artery events, less need for cardiac vascularizations, less cardiac death. So, kind of begs the question, what's the number one, outside of cancer, the biggest cause of human death? Cardiovascular dysfunction. Endothelial, which is the lining of those little arteries that we have that over age we don't take care of. We smoke, we are diabetic, cholesterol's high, and that's what is the damaging part. And that's where the Cialis and all these pills work. It brings in nitric oxide, more of it, so that these vessels dilate. They keep more elastic.
Now, I'm gonna ask you.
Like the gymnastics of your.
I'm gonna ask you, what's a Superman? I heard of this thing called Superman, where you mix a Viagra. Can you take both?
So, Nate Bargatze would say, his skit from SNL, nobody knows. I mean,
Can you take too much of it then?
well, again, in the studies, the patients tried even higher doses, like the Cialis or the Viagra, 100 milligrams 3 times a day. I mean, it helps with relaxing your pulmonary vessels to have less pressure, so your heart doesn't have to push against such a high pressure because you have stiff lungs. That's what it's pulmonary hypertension derived in these patients with bad hearts. But it's not like they had better erections. So I think the whole idea with, if you take more or mix them,
Yeah.
you may get some hypotension. I mean, that's one of the things. If you're on a nitrate and you don't take these pills, because it's going to help relax a vessel that's already dilated because you're on nitroglycerin for patients with cardiac
What
events.
about citrulus? I heard like citrulus on one of these podcasts, like as a like a like a vitamin, or like a.
Again, everyone wants the magic pill. I think that's the thing is human nature, we're lazy. You don't want to wake up at 5 in the morning to go to the gym and get my exercise. I'm going to sleep in. I'm going to go and get an extra snack. I'm going to go for my midnight, bag of chips at night. That's the thing is, I think there's those elements. That's your key. That's your foundation. I think we all want the elixir, and you have to invest in yourself, and you have to, do things that you need to do to protect your vehicle.
So if we wrap this up, another question: How how can men boost their sex drive? What can men do to? Is there?
Move to somewhere warm, I guess. Number one, or if you're always cold, that doesn't help. I think stress is just not something we talk about, and I think we all just pile it in and put it in our pockets and just deal with another day. And I think if you're always in that sympathetic mood, you're not relaxed. Uh, you know, uh, we don't measure stress, we don't measure anxiety, and I think that's a huge killer of the sex drive, right? And I think with it too, communications with your partner, we're not men are cavemen. We just run into a room, we don't talk much, we don't express ourselves, and I think I've learned like men and women are two different animals, and I think our ability to communicate with each other is where we need to work on in a relationship element. I think that's explaining, talking about our feelings, expressing ourselves to our partner, and then talking about what our desires are. What are you looking for? And then if I can serve that, then it becomes this like fusion reaction of a nuclear reaction. Like we work on each other, and that's great. but self-esteem, feeling invigorated and energized. And, you tell me, how do I get in good shape? I think same question. Is it,
Yeah.
I'm going to go to the, Popeyes and buy some arginine? I'm not
Exactly.
sure that's the answer, right? It's,
I think that's one thing when you look at, I've been doing the show for years, and I still look at, other shows, and you have all these supplements and all these, drink your, watermelon juice and take your L-arginine, take citrulus, and you hear all this, and it then becomes confusing. You're like, how much of this actually is going to make a difference? All these foods and diets sometimes that are like made to help and increase your sexual drive or your sexual performance.
again, if you look at a couple things, science, Oxford criteria, there's different levels of evidence. So there's five. Some people I just joke around like that sounds like level six evidence, which is non-expert opinion. So like level five is someone who's an expert.
Yeah.
At least they can give their opinion on 30, 50 years of experience. But some people, again, you just, you want to believe in it. It just sounds so
Mm.
good to be true. And what's impressive, any study that you see in a randomized study, there's always a placebo arm.
Yes.
You're getting nothing, but you believe you're taking something. And it's impressive what placebo can do
Fine.
to improve. And even people have side effects. They have these bad reactions from placebo.
Yeah. Power of
So,
the mind.
what exactly is it? Is there that biopsychogenic reaction or response? And I think that is it stress? Is it our wanting or believing that's going to be better and our perception of what's better? So I think that's, and how do you change your perception of things? And I
Good
think
point.
I think that's a lot of things of, you know, my brother always, says, to be happy, if you have low or no expectations, you're always happy.
Point.
So to set up high expectations of things that you're not going to achieve, you're going to constantly be in a state of, disappointment. So, in my dad's, words of wisdom. So sorry. Say that again. Yeah. So, and my dad's words of wisdom, someone who has like what you own owns you. It's like
Point.
you want a cottage, you want a this and that, and you're constantly running around doing everything else. And are you free? And I think one of those elements of learning to say no and how to cut things out and give more time to yourself. Because as we get older, I think everyone wants to latch on. I need a bit of this. You become implemented, and at a certain point, you want to have time for you. And then some people are going to be in resentment because I'm never getting what I want to do. And I think that's the inner psyche that we all struggle to deal with is what I want to make myself happy. And same time, you have all these other roles. I'm supposed to be a dad. I'm supposed to be a teacher. I'm supposed to be my parents want to spend more time with me. So how do you balance all that out and to be happy? And what does happiness mean?